other people who can't make it. Okay. So lab. Most of you have me for lecture. A few of you have Dr. Wooten. So I'm going to go over some basics. I'm Dr. McDaniel. There is my contact info, and I'm going to go through Canvas first to kind of show you where your grade comes from, the schedule and all that stuff. And then we'll get into the lab for today, or the 2 labs that we're doing today. Okay, so hopefully you guys can see pretty well on Zoom. That's as close as I can get you, sorry, but you'll know what I'm talking about as I'm going through Canvas. Okay, so first off, it's always cold in here, so bring something warm to wear. I don't know why, but it is. Lecture and lab they're separate courses. So it's 1 hour that's separate from the 3-hour lecture. They're not combined. So the grade you make in here doesn't affect the grade that you have in lecture. That's why if you don't have me for lecture, you might have me for lab, or if you have me for lecture, you might not have me for lab. So they're kind of separate, but we try to link them up as much as possible, at least topic wise. So what you learn in lecture, we go over a lot more in lecture than we do in lab. But the stuff we do in lab is focused on kind of helping you apply what you learn in lecture, which is generally the idea of a lab. So no different from most other labs. And we're trying to really line up the topics a little bit better this semester. They don't always line up perfectly, but we do kind of the best we can. This week, we're covering stuff that some of which we haven't gotten to it in my lecture anyway. Dr. Wooten may have gotten there by now. I'm not sure, but so some of this will sound new. You won't have seen some of this terminology, et cetera. But if that's the case, I usually do a really brief intro before each lab, but I try not to talk much in lab. I'll talk a lot this week just because we have to talk about the course and stuff, but generally it's really self-directed. So the goal is you guys take the time that you need to learn the material that's in the lab manual for that week. If you don't have the lab manual yet, it looks like this. I think there's an older version. You can buy that one if you want to, like one older. This is 7th edition. The info is on the syllabus in here in Canvas, so you can find the specifics that go past it. Yes. There's the information about the lab manual. I think there's an electronic version too, if you'd rather have that. I don't care. You're not going to be turning anything in from the lab manual. You mostly just need the information in here for the quizzes and the exams in lab. So if that helps you at all, awesome. I always like having a physical copy, but I know not everybody cares all that much. Okay, so lab manual. It's very self-directed. I'll have a few activities for you to do just to encourage you to kind of apply what we're talking about and what you're learning. But for the most part, it's going to be you spending the time learning, say, the bones or the muscles or the tissues that we're looking at. All right, so first I want to show you the syllabus. So you guys on Zoom, go to the syllabus and you can kind of follow along. I'm not going to go through everything, just the really important stuff. My contact info is here, obviously, and my office hours. My office is right across the hall, so that's easy to find. As far as grading, most of your grading here comes from the lab practical exams. So they're called practicals because you're kind of applying what you're learning. They're mostly multiple choice. We'll talk about them as we get a little bit closer, and I'll show you. I think I've already put them on the calendar, so you should see them already in Canvas and when they are. That's 65% of your grade. It'll only cover obviously what we're doing in lab. There are quizzes most weeks. So there's 7 total quizzes. They're going to be on Canvas. So the first one, I'll show you where to find it, but it'll be available after this lab is over. So at 3 p.m. it'll open up. It's a 10-point multiple choice quiz. You can use your notes if you want to. You can challenge yourself and not use your notes at first. There is a 15-minute time limit, so you need to finish it within 15 minutes. I don't mind if you use your notes. The idea is to make sure you're kind of learning as we go rather than getting to the first practical and freaking out. So that's 25% of your grade. Those can really help your grade in here. And I'll show you when those are happening. Lab activities and worksheets are basically being here and doing the things that I hand out to you that you need to finish before you leave. I'm not really checking for correctness there. If you have questions about them, obviously ask, but I'm mostly just, it's a way, otherwise people just end up leaving. So that's basically participation. You can think of it that way. Nothing too intense. The lab practicals, we'll talk about the details of them, but you want to take notes. You don't need to know absolutely everything from your lab manual for all of these labs. So take notes on what I say you do need to know and don't need to know. If you miss a practical, yeah, if you think you're going to miss one, let me know. There's some different procedures we have to do. We typically don't do makeups. So you can go to another section, or if you just absolutely can't make it to any of the lab sections that week, then we'll kind of just excuse that lab practical and average the other two. So that puts a lot more pressure on the other two practicals. You don't really want to do that, but sometimes that has to happen. If you're in a if you're gone for athletics, definitely let me know and we can work something out. The quizzes, like I said, you have to finish them before the next lab. So you'll have 2 weeks to do this one since we're not meeting for lab next week. I'll show you that schedule in just a second. You'll have 2 weeks to complete the quiz on this week's exercises. Attendance, that will kind of show up as a grade in that lab activities and worksheets. If you're not here and you don't do the worksheet, you get a 0 for the day. So be here. If you can't make it, you can come to another lab section potentially. So just keep me informed if you're not going to be here. Okay, I think that's most of it. Most of the basics. I will show you. You go home. Just like in lecture, I have a lab schedule here. So you can see what we're doing each week. And this week we're doing 2 exercises. Some weeks we'll be doing 2. A lot of the weeks we'll only be doing 1. So we're going to do the language of anatomy and organ systems. So those are the first 2 labs in the lab manual. Next week, no lab, because Monday's a holiday and we have Monday labs. So no labs all week, just so we stay on track. Your first quiz is going to be due the Wednesday, 2 Wednesdays from now, basically 2 weeks. So you have to complete that before lab. Finish it by 1 p.m. Otherwise it gets shut down. If you turn it in late somehow, you get a 0. So make sure you don't leave it to the last minute. Once you start it, you have to finish it within 15 minutes. I think I mentioned that. Okay, and you can see where the practicals are. So the first one is on February 9th. And that's exercises 1, 2, 5, and 6. So basically what we've covered up until then is what's going to be on the practical. And there are 3 practicals. They are not cumulative. So once we get through practical 1, you can forget all that material if you want to. Okay. Questions about a schedule? All right. The Zoom link, this is just for people who are quarantining and can't make it. I don't know that I'll do this the whole semester, but if you have to Zoom it, if you can't be here and you're quarantining, let me know and I'll kind of figure out what to do. But that'll be active all semester if you can't make it for a valid reason. I am recording it, awesome. Okay, so after that on Canvas down here, so this will be general course info, and then I'll have a module for each of the lab weeks basically. So labs 1 and 2, that's this week. I'll have a basic presentation, which is what I'm going to go into next, but it doesn't really have a whole lot of information. It's mostly just for me to point out to you what you need to focus on in the lab manual and kind of give you a little bit of background, especially if it hasn't been covered in lecture yet. So I'll have one of those almost every week, but it'll be pretty bare bones, like very simple. The other thing I've posted here is essentially, I'll post stuff that you can use to study and kind of practice with. So this PDF that I posted is this figure that you're gonna work on today with the anatomy terms. So you can print that out like 10 times if you want to quiz yourself. You can try to fill in the blanks each time, because that's the kind of questions, I'll ask you questions from this on the quiz and on the practical. So you want to know the different terminology, which I'll get into in a second, but anything else I post here isn't something you necessarily need to turn in. It's mostly to help you study this material. Okay. Oh, and then the quizzes are obviously under quizzes. Quiz 1 I already have up, so it'll be available, like I said, at 3 p.m. So at the end of lab today, we'll be done before 3 today, but it opens at the end of the scheduled lab time, and then it will close January 26th at 1 p.m. You don't need lockdown browser. You don't need anything special for it. Just take it. It shouldn't take you too long. Student responsibility agreement. Yeah. So that's also on the homepage, just like for all of your other classes. If you fill out the student responsibility agreement, you get a bonus point on your first practical. So definitely do that by Friday. So after Friday, if you fill it out, you don't get the bonus point. So go ahead and do that. And I think that covers everything I wanted to talk about with the overall course structure. Any questions about that? I feel like I'm forgetting stuff, but okay. So we're going to get into the lab for today. Jump right in. All right, so first we're going to talk about that exercise 1, they call them exercises, in your lab manual. Let me open that up for you guys on Zoom. Okay, so you should be able to see that now. All right, so exercise 1 is all about sort of terminology and how we refer to different parts of the body, different orientations, different body cavities. This first lab is really heavy on terminology, so don't be scared off. It's just a lot of new words that will come up over and over again in the semester. So it is important to learn them. It's not just a pointless vocabulary lesson. The first thing you really want to focus on is that first diagram in your book. So page 2 of the lab manual. The words that you're going to use to fill in those different parts of the body. So these are surface anatomy terms. So for the surface of the body, there's specific names for certain parts of the body. And they're super, well, some of them are really easy, like oral is for mouth. Others are not so easy. There are 3 on that first page. I don't know why they split the terms like this, but don't forget those first 3. So there's the term and then the definition. And for you guys on Zoom, in just a second, I'm gonna, in case you don't have the lab manual, I'm gonna upload these labs to Canvas. I totally forgot about that, and then a couple other things. So hang tight for just a second. Okay, so you're going to use those first 3. Yeah, don't forget the first 3. So acromial, that doesn't, probably no one has heard of acromial before, right? That's the point of the shoulder. So acromial is right here. I just point that out to show you that there's a lot of weird sounding words in here, but they'll come up again. So acromial, there's part of the collarbone that's called the acromion that you will need to know eventually. So if you learn these now, it'll make learning some of the other parts of the body later on a lot easier. So that's why we're starting out with this. So go ahead and work on that. You guys in lab, I'm going to upload some stuff for the people on Zoom right now. So start filling that in as best you can, and then I'll continue on with the rest of this. Okay. Okay, so for those of you on Zoom, I just uploaded Lab 1 and Lab 2 to Canvas. So if you need copies of those, if you don't have the lab manual yet, you can use those and fill out that diagram on page 2. So I'm going to give you all a few minutes to look at that. Is anyone having trouble with any of those? Like totally lost on where something goes? And also, I don't think I mentioned this, there's a few terms on page 3 too. You guys probably saw those, but 1, 2, and 3 has terms to add to that diagram. All right, I know not everyone's done, but I'm going to move on to the next thing, and you guys can come back and continue to fill that in, or kind of fill it in and also listen, whatever you prefer. I'll run through a couple here. I'll ask you what you got. So does anyone know what's the front of the knee? Patellar, right? So like your patella is that bone on the front of your knee, so kind of easy to remember. How about like the belly button area? What's that? Umbilical, yeah. Abdominal is kind of the whole region. Yeah, umbilical is that like specific center under the belly button. It's where the umbilical cord was attached. And then how about one on the back, this kind of upper back area? You guys know what that is? You know, yeah, scapular. So your scapula is your shoulder blade. That area is called the scapular region. So again, all of these most of these will come up. The thumb and the toe, the pollex and the hallux. I don't know that we really ever use those again, eventually maybe, but There's some that are more useful than others. Scapular, definitely. You're going to have to learn about the scapula, the different pieces of it. So a lot of these will come back into play. Okay. If you continue doing that and then have questions about it, come ask me after, you know, when we're just kind of working through other stuff in lab, if you're confused about any of that. Oh. Put that up again. Okay, so the next part that you need to know from this lab is the body orientation terminology. So this is a slightly different, it looks pretty similar to this diagram that you have in your lab manual, figure 1.2. The idea behind these terms is to talk about the direction and the relative position of different parts of the body. So we'll start with, you can see the definitions in your lab manual. Right off, you can cross out that cephalad caudal, the one up here on the upper right. I don't talk about cephalad or caudal. We'll use superior and inferior. So you can see them both on this diagram too, but cephalad and caudal are like head and tail. It's more animal, non-human oriented. So we'll just use superior and inferior. You can ignore those other two synonyms. Okay, so we'll start with the superior, inferior. Superior means on top, inferior means below, duh. So how do we use these? Typically, you would say it's all in relation to some other body part. So the head would be superior to the abdomen. You always have to, you're comparing the location of two things. That's the idea behind these terms. The leg is inferior to the abdomen, again. So something is inferior or superior to another part of the body. Does that make sense? It's all relative. You can't just say the head is superior. It's superior to something else. So superior, inferior, pretty easy, above or below. Anterior and posterior. There are synonyms for these and you need to know them. So anterior is towards the front of the body, posterior is towards the back of the body. The synonyms here are ventral and dorsal. That is also more animal oriented. Animals that are on all fours have a dorsal side, like a dorsal fin of a dolphin, that's their back, and then a ventral side, which is their underside. But these are used a good bit in human anatomy as well. So you'll see dorsal and ventral a lot. So I do want you to know those. So the, let's see, the sternum would be anterior. So your breastbone would be anterior to your spine, right? Your breastbone is on the front side of your body compared to your spine. Proximal distal gives people a little bit of trouble. Just make a note that proximal and distal is really only used on your limbs, so your arms and your legs. Proximal means that something is closer to the trunk of your body. Distal means it's further away. It's a distance away. I guess that's how I think of it. So if you're talking about your leg, the knee would be proximal to the foot. Your knee is closer into the trunk of your body than your foot is. So your foot would be distal to the knee. You can flip it and use the opposite. Does that make sense? Proximal distal is a tough one. Medial and lateral. I have, I think it's not on the diagram, even in your book, and it's not on here. Those are two you want to know. Medial means toward the midline of the body. That is in the list of definitions. It's just not shown on the diagram. Medial is towards the midline of the body. If you're thinking the midline would be like nose down the middle. Lateral, off to the side. So your ear would be lateral to your nose. The ear is further off to the side compared to your nose. Your nose would be medial to your ear. Superficial and deep are the last two. Those are also not on the diagram. Superficial is towards the surface of the body. Deep is deeper within the body. So what's a good example? Your skin would be superficial to your lungs. Your skin is more closer to the surface of the body, is the surface of the body compared to your lungs, right? So deep versus superficial. Questions about those? Oh, I have a worksheet for you guys to work on for that. There's a little practice in here that you can do as well, where you fill in those terms. They give you two body parts and you're supposed to say what direction they are in relation to each other. And then what I do want you to complete is the back of, I'm gonna hand this out. So there's more practice here. I think these are a little bit better and gives you more practice with these orientation terms because they're sort of hard to wrap your head around. So more practice is better. I'm gonna hand these out along with one other sheet. For you guys on Zoom, I just uploaded something called Ammerman Lab 1 activities. So you should see a PDF with something like that in there. You can download that. Yeah. So there's two sheets of paper here. I'll talk about the other one next. But on the back of that really long terminology list, there's some additional terminology on there if this is helpful for you. But you just need to know from that list what's in the lab manual. I don't usually have some handouts in the lab. But I get calls. There you go with those. So before you leave, this is kind of part of that 10% of your grade. You want to fill these out. It's on the back of this long list of terms. Fill in those blanks with these body orientation terms. For a couple of them, there's more than one good answer, and I'll accept both of them, obviously. Keep in mind when you're thinking of these relational terms, you want to imagine it's assuming the person is in anatomical position. Anatomical position is when they're standing up with their feet facing forward and their arms kind of by their sides. Technically, the palms are facing forward, so this would be anatomical position. So when it says the arm is blank to the torso, the arm is here, not like up here, because I know we can move our arms, but you're assuming anatomical position. Okay. So I'm going to keep going. You guys can work on that after I kind of get through this. Oops. The next thing from this lab is the planes, the different body planes. This is a little bit weird to think about. The whole idea behind these planes is that if you cut a body or an organ or part of a body into these different planes, you can see the organ or the internal pieces a little bit differently. You see different features of them. So what you need to know here really is just, if I showed you one of these diagrams, you would tell me what plane is being shown. So we have three, technically three different planes that we can cut the body into. So if we cut the body down the middle, like down the middle, so there's a right and left, that's the sagittal plane. If it's right down the middle, it's mid-sagittal. If it's kind of, it can be off to the side a little bit, but still be sagittal. But for our purposes, just know sagittal. Frontal or coronal, that's another, those are synonyms that you'll need to know. So you need to know both of those terms. A frontal or coronal plane is where the body is cut down the middle. So there's a front and a back section. Transverse is easy, just cutting basically parallel to the ground. So right across the body. Why would we ever do this to a human, right? It's kind of weird showing it like this, but this is kind of the best example for these basic definitions. And this is the kind of thing I'll ask you. I could show you this diagram and say, what plane is that? And you would say transverse plane. How is this actually applied? If we look at, you take sections of different organs a lot of time. Well, you don't. People do. People who are doing medical research will take sections of organs. So they'll cut them on a certain plane. So a frontal section, say, of the brain would be cut where you see that plane is, and you get that view of the brain. Oh, sorry, you guys on Zoom, I'm probably covering you up. There we go. If you cut on the transverse plane, you create a transverse section, it's a different view of the brain. This way you're looking kind of down into the brain. Like if this was his brain, I'd be looking down into it with the top cut off. So different view of the brain, you see different features. And then sagittal or mid-sagittal is right down the middle. So I would see kind of on the inside of the right and the left part of his brain. Just a different way to look at organs. That's the whole purpose. But like I said, if I ask you a question, it's going to be a very similar diagram to this whole person and asking you what plane it is. Oh, for you guys on Zoom for the worksheets, sorry, Catherine, I just saw your chat. I'll set up an assignment so you can upload them. Okay, if you fill them out, I'll have you guys upload them. Good question. Okay, so those are planes. Pretty simple. The next big thing, like I said, it's a lot of terminology. Try not to get overwhelmed. You have 2 weeks to kind of learn this and review it. And we'll be doing this in lecture. So all of these things that I'm talking about, at least in my lecture, we'll be covering on Friday. So you'll see it today, and then you'll see it again on Friday. And Dr. Wooten will cover it either today, Friday, Monday, somewhere in there. We're trying to stay on the same schedule. Okay, body cavities, that's the next part in your lab manual. So pretty similar diagram. There's a few little differences, but you want to know these different body cavities. Some of them are super easy, like the cranial cavity. It's your brain, right? Cranial cavity in the head. These cavities hold different organs. You want to know the names, and then what I'll ask you is I'll show you a diagram very similar to this, have a line pointing to something without the name, obviously, and say, what cavity is this? So it'll kind of be you filling this in, more or less, from memory. But I'll give you the options. It'll be multiple choice. Okay, so we have the cranial cavity and vertebral. Sometimes it's called spinal cavity, spinal or vertebral. The cavities so overall the chest is the thoracic cavity. So thoracic and then abdominal. Those are the two really big ones. Within the thoracic cavity, you have your lungs, obviously. Those are in the pleural cavities, P-L-E-U-R-A-L. Not like a plural word. Anytime you see plural, that refers to lungs. So if you see that pop up somewhere else, you'll know it's at least referring to something to do with the lungs. The heart is in the pericardial cavity. That's pretty easy to remember. Cardial refers to heart. Peri means around, so it's a cavity around the heart. The mediastinum here is sort of, I think in your lab manual, it shows, yeah, the mediastinum is a little bit different from what's labeled here. But the mediastinum is this cavity that houses the sort of bottom of the trachea and then the heart. So this whole thing is the mediastinum. I don't know where that word comes from. I should. Abdominal cavity, this big one, that's pretty easy. The pelvic cavity, where the reproductive organs are in the bladder. Combine it in your book. Yeah, so it can be combined. It is often referred to as the abdominopelvic cavity. So if I had a bracket here and said, what cavity is this? It would be abdominopelvic. Just this is abdominal, just this is pelvic. So follow what's in your lab manual. This one, like I said, is slightly different for some reason. I don't know if it's an older version. I think those are the main ones, craniovertebral, yeah. And then you have the ventral and dorsal. That's the different colors here. So ventral on the stomach side, dorsal on the back. Okay. Almost done with this one. The second lab is, there's material you need to know, but I won't be saying quite as much. So that's a good thing. Body cavities, know those. The abdominal regions. The abdomen is complicated and there's a lot of really important stuff in our abdomen. So we've divided it into a couple different ways. In your lab manual, you'll see at the top, you can divide it into 4 quadrants, the right and left, upper and lower. Pretty easy. I will say here, and people often confuse this, the right and left is the patient's right and left. It's not your right and left. So here, the right, you're imagining this patient is facing you, you're facing them. The right is their right, not your right. It's always that way. So this is always going to be the right side of their abdomen, right? So keep that in mind. You will need to differentiate between the right and the left. So it's always the patient's right and left. Theirs matters a lot more than yours. Say if you're performing surgery on somebody, you want to perform it on their right and not your right. Okay, so you have those upper and lower, right and left. General quadrants, I'm probably not really going to ask you about those. I will ask you about these other 9 regions within the abdomen. It's a lot of complicated sounding terms, but I'll try to break it down in sort of an easier way for you. You have right something all down the right. You have left something all down the left, right? You have 3 on the left, 3 on the right, and then 3 in the middle. The right and left are the exact same except for the right and left. So they're easy. If you remember one of the top ones, you'll know both of them, as long as you remember right is the patient's right. Okay, so we'll start at the top. Hypochondriac. So I often, I don't know if I've said this, I repeat myself a million times because I teach this lab a bunch. Hypo always means below. I will often break down words for you because they're easier for me to remember that way. So if you know hypo is below, you kind of have a leg up already in understanding the word, right? You don't have to memorize every single word that starts with hypo. If you know hypo is below, then it gives you a clue as to what we're talking about. Chondriac refers to ribs. So hypochondriac, not like someone who thinks they're sick all the time. This means below the ribs. I don't know where the hypochondriac that everyone kind of knows comes from, but hypochondriac means below the ribs. So we're talking about this area under the ribs. So kind of like right up here in your abdomen. You have a right hypochondriac and a left hypochondriac region. Lumbar, that's one of the regions, one of the areas on the surface anatomy terms that you need to know. Lumbar is lower back. So right lumbar and left lumbar, just on the other side, on the ventral side of the body, right? Iliac is the groin area, or kind of the hip area. In your lab manual, it is also called the inguinal. So inguinal refers to groin. You want to know iliac and inguinal for this, and those are both listed in your lab manual. That's another annoying synonym that you need to know. Well, they also have lateral for lumbar. You don't need to know lateral. So you can cross out lateral for this one. So lumbar, iliac, or inguinal. So really that's just 3 on 3 will cover 6 of these boxes, right? If you know hypochondriac, lumbar, and iliac, then you know right and left. Down the middle, we'll start in the middle here, the umbilical region right under the belly button. So that's pretty easy to remember, umbilical region. And then we have two gastrics. Gastric refers to stomach generally. Epi means on top of, so epigastric is the one on the top. Hypo, again, means below, so hypo is the one on the bottom, hypogastric. Okay, hopefully that helps. If those don't help you, if it's just more work for you to remember what those terms, what those like prefixes and root words mean, don't worry about it, but in the long run, it'll simplify things and you can kind of see a word and sort of understand what it means, even if you don't know the definition. Okay, so those are the 9 regions of the abdomen, and I think that's the end of the first lab. Okay. So for that lab, there's not really much of an activity to do in your lab manual. So I handed this out. It has a lot of words on the front, which are also in your lab manual. So you don't really need to read this. But down here, you can kind of see where the organs are found. And on the back, you have different body cavities and then different quadrants. So it's 4 quadrants of the abdomen. And you're going to write what organs are found in each of these cavities or quadrants of the abdomen. I crossed out peritoneal cavity because we don't really talk about that. So you don't have to do the one that I crossed out. So that's another thing that you'll do before you leave. So that, and then these orientation things, that's all you have to do before you leave. You can leave before that, but you won't get the 5 points. For organ systems, for exercise 2, it all just comes down to one table, essentially. And I went over these in lecture today. I'm not sure if Dr. Wooten's gotten here yet, but you want to know table 2.1, essentially. So there's the name of the organ system, the organs that are included in it, and then the functions of that organ system. So what we went over today in lecture is really all I'm going to ask you about. So you don't need to know every single little thing from there. And those of you who aren't in my lecture, I will get you that information so you don't learn more than you need to about the organ systems. Organs and functions, the names of the 11 organ systems. We're not doing, oh, we can't do dissections in here. I don't think I said that yet. So there's a rat dissection, there's pictures of rat dissection in here, and you can look at the actual organs. But we can't do dissections in this room because the ventilation isn't good enough, I guess. So anyway, it's helpful to actually see organs in an animal. So you can look through that if you want to, if that's helpful. And I think that wraps up. That's really all you need for that second. That's the main piece of that second lab exercise. Just know the organs of those systems and their functions. And I don't have an activity for that. That's more just kind of memorization. Questions? Okay. I'm going to let you guys work on these 2 worksheets and anything else you want from those labs. There's some other activities in there for like questions if you want to fill them out. But from here, usually after I do kind of a general intro, I just want to be here to answer questions for you. So you work at your own pace, do what you think you need to focus on, and then obviously ask me questions, raise your hand or come up here and I can help you out if you get stuck. Sound good? Okay. All right, so for you guys on Zoom, you just have a full kind of PDF. This is a chart that you want to fill out with the organs found in each of these cavities or quadrants of the abdomen. So fill that out. And then also, like I said before, these directional terms, just fill in these blanks. So those That's all one file on Canvas. So you should have access to that. You can print it out, or you can fill it in electronically, or just type the answer into a text box. I don't really mind how you do it, but I'll set up an assignment so you can upload those and just get them uploaded by the end of the week. Any questions from you guys on Zoom? I hope that was kind of helpful.